Hi, my name's Dr. Justine, and today we're going to be talking about how we can get numbness, tingling, or weakness in our hands. It can be so disruptive if you can't sleep because you got numbness in your hands. You feel like you got to shake your hand in the middle of the night or when you wake up. So we're going to be talking about carpal tunnel, double crush, and triple crush, and how you can have damage in your neck that could affect down your arm. So let's get really straight on what the different diagnoses are. If you have carpal tunnel, that's numbness and tickling, typically in these first three fingers or in the palm top of the hand. And it comes from the lower part of the neck, but that's the median nerve, and it can get aggravated in your wrist. One of the ways you'll know you have carpal tunnel is if you tap on your wrist and it's aggravating. It causes more tingling and numbness in your hands. We're going to go over treatments after this, but let's cover the different reasons that you could have numbness and tingling in your hand. So that's carpal tunnel. It comes from the wrist. Often there's different types of treatment for that, and we're going to go over it. There's also pronator teres syndrome, where the median nerve can get aggravated on the top of your forearm as it comes into your hand, and it has a similar presentation to these three fingers and into the palm and the top of the hand. Both of these can cause numbness, tingling, even weakness into your hands. Similar nerves can affect hot and cold, the spinal thalamic tract. So sometimes people could have cold hands, but that has to be checked in case you have Raynaud's syndrome as well. So we have carpal tunnel, we have pronator teres. As we move up, we know the nerves in your neck can get aggravated from here, and that can be caused by subluxations, misalignments of the spine that put pressure and twist and turn and put pressure on those nerves that exit down your arm. That's what a chiropractor is an expert in finding and removing. Those nerves in your neck can get affected in your shoulder. It's called the brachial plexus, as it exits your neck and then it comes down your arm. So if we have triple crush, it could be affected in three areas: your neck, shoulder, elbow, or wrist. Three of those four areas. If you have double crush, it could be your neck and one other area down your arm. The other thing that we can have is degenerative joint and disc disease. That's when the shock absorber, the part in between the bones, is getting compressed, and it can put pressure on those nerves that exit down your arm. And lastly, you can end up also with stenosis. That means that the bone has grown and the actual hole for the nerve is getting smaller because of bone growth. And that's absolutely the worst and the hardest to work with. And it's very hard to do passive care, but physiotherapists, chiropractors, acupuncturists, naturopaths, we would all work with all of these different conditions. Chiropractors would be working with the spinal care. Acupuncturists will help reduce inflammation, and naturopaths also do acupuncture. Physiotherapists will help give you the exercises and help reduce inflammation and tension. So all of these are really helpful for anything that's aggravating in your hand. Now you might end up with tingling and numbness in the outside fingers, and that would be the ulnar nerve. So the radial nerve, median nerve, and ulnar nerve. And the ulnar nerve is also called thoracic outlet syndrome. It comes from the lower part of your neck, and that would radiate from your neck down that brachial plexus, but go to your outside two fingers. Often aggravated with work above head. And what can also aggravate is when people sneeze or cough and twist into their arm or lift something with a twist. That can aggravate your neck for some of the disc subluxation areas or thoracic outlet syndrome, also called TOS. So that gives you some of the areas that can affect with your neck. Now we want to talk about different ways of treatment. So for your wrist, if you're getting carpal tunnel, one of the best things to do is get what's called a night splint. That's a little brace. They're now very inexpensive, around $20. And they can go from your top of your hand. Try to get one with your thumb too, so you don't fold your thumb in. And it will hold your wrist in a straight line. The thing that happens is people sleep, they bend their wrist and they cuddle, or they get their hand up and they twist with their hands, and they don't realize that they're sleeping with their elbows and their wrists bent. And that will aggravate double crush, triple crush, and carpal tunnel. So the wrist splints help keep your wrist straight. They're very light. They're now very comfortable. They're not hard as rock anymore. You don't have to get a hospital to get a night splint. They're easy to order off Amazon, and you can help keep your wrist straight in the middle of the night. You'll also want to make sure if you're on a keyboard a lot that you have proper ergonomics for your wrists and your elbows, so that your elbows are at your side and your hands are in a good position so that you're not aggravating it with work. All right. Now, we talked about the sleeping position, no hands up, proper bracing. If you have disc damage, you may need a hard collar. I needed that for a while. And then I moved to what's called a soft collar or an air cast. It's like a blow up balloon around your neck that stops you from sleeping with your head bent or tilting your head in the middle of your sleep. It also helps extend, like raise your head up, so it takes the pressure and the weight of your head off of your neck to help the nerves from your neck heal that might go down your arm. So it can create tractioning. At the office, we help teach cervical tractioning, neck tractioning, and cervical rolls, different equipment for you to help if your problem is coming from your neck that can affect numbness and tingling down your hand. So there are also passive strengthening exercises called isometrics before you get into active ranges of motion that might aggravate you in the beginning. So be very careful. We have our kinesiologist, our team here that will help give you specific spinal rehab for your neck. For your wrist, you can do stretches where your hand goes down, pull your fingers down, and pull your fingers up to stretch those muscles on the bottom and the top of your forearm. A lot of these challenges happen with the shoulders rolled forward. So to do big pec stretches, stretching your chest, rolling your shoulders back will help those nerves that come down your down your chest and come down into your forearm. Some of the nutrition can help here. Your B vitamins, particularly B6, can help with carpal tunnel. And natural anti-inflammatories like your curcumin, turmeric, devil's claw. We have those in our office, some of the natural anti-inflammatories. And our naturopath can go over some custom natural anti-inflammatories so that they don't affect your stomach like typical anti-inflammatories that could be prescribed to you. You want to make sure that you're relaxing those muscles. That can help with things like Epsom salt baths and gentle stretching. And our physiotherapist can give you some of those stretches. I'm going to make sure that I'm not going to miss anything. Things that can make it worse is looking down. So with carpal tunnel, bending your wrist, typing with your head down. Anything where you have a big pillow that forces your head forward can damage the proper curve in your neck, because we want to have that C curve. The nerves at the top part here do affect your hands, but they also affect your brain. They affect your thyroid. They affect your blood pressure. So that's your brain stem. You want that C curve, so looking down can aggravate it. If it gets really severe, when my hands were tingling and numbness, I couldn't even hold a fork. I couldn't hold a pen, and I needed to eat and bring the food close to my mouth so that I wouldn't look down. So come and chat with us. We offer free meet and greets, opportunity to ask us questions, find out the right treatment for you. If you have numbness and tingling, find a way to help it. This is something that you want to help without surgery. So here at the Justine Blainey Wellness Center, we offer complimentary meet and greets, 5 to 10 minutes, ask questions, and find the right treatment. We look forward to seeing you or a friend or family that's suffering with that numbness and tingling in their hands or coming down their arms. See you soon.